Hi everybody, welcome back to my channel. My name is Maria and I am a PA student in my clinical year. Today I'm going to go over this highly requested video in regards to what to expect during your clinical rotations, kind of how to prepare for it. So let's just get started. So your didactic year has finally ended. Congratulations. But you're kind of nervous, you're anxious, you don't really know what to expect. It's your first rotation and you have no idea where you're going to be. So I'm just going to go over a couple things that will help you prepare and kind of what you should expect during your clinical rotations. So the first one is to email your preceptor. You're going to email your preceptor about, I would say every school is different. My school recommended us to email our preceptor 1 week before instead of like 2 months before, only because the preceptor may forget that you are arriving at that date if you email them too early. So I emailed my preceptor about 2 weeks before, and here's what I emailed them. I introduced myself. I told them, hi, my name is Maria, or Maria is my actual name. Hi, my name is Maria. I'm a PA student from this school. This is my first clinical rotation. I'm really excited to be here with you guys. Thank you for allowing me to, further my education at your clinic. I was just inquiring about the dress code, the schedule, what time I should show up, and parking. And generally, you should also let them know what day you're going to be coming. Just let them know, oh, my clinical rotation, I'm supposed to be here Monday. Just wondering what time should I come in. So they should email you back, hopefully within that week, and you can get started and it should be all good. You can also email them inquiring about resources, such as like, hey, is there any sort of books I should be reading up on? Is there like a clinical disease that's like very predominant, such as like diabetes or hypertension, and they'll tell you, especially if you're doing an elective rotation. So for example, I did dermatology and my preceptor told me to really look up on basal cell, squamous cell, melanoma, psoriasis, eczema. Those were really big things that they saw in the clinic. So you emailed them, you're asking about dress code, and most likely the dress code is going to be scrubs or business casual. So business casual means like a nice shirt, nice sweater, the blouse, and black pants, dress pants. I don't really go into the clinic, even though business casual can also mean jeans. I don't really go into the clinic wearing jeans. That's just kind of what I assume. Most of my clinical rotations, I wore business casual, except for general surgery. They actually provided us a pair of blue scrubs in the hospital, so that's what I wore every day in surgery. It was like a sterile thing as well. So yeah, expect scrubs or business casual at your clinical rotation. So your schedule is pretty much going to be dependent on your preceptor. I want to say in a lot of my private clinics, I was 8 to 5, but in the hospitals, it could have been different. A lot of my classmates, sometimes they had 7 days on, 7 days off. Sometimes they had 24-hour shifts. In my general surgery rotation, it was sometimes 2 or 3 days out of the week, it was 6 a.m. to 9 p.m. So it was kind of hectic at times, but it was doable. If you do have doctor's appointments or something comes up, discuss that with your clinical director and your preceptor. So your preceptor, let's say your preceptor tells you, hey, we start seeing patients at 8 a.m. You want to be about 15 minutes early, 15 to 20 minutes early, especially on your first day. One of the biggest thing is navigating through the clinic, or if you're in a hospital, you can get lost really easily. What I like to do is a day before, I like to drive to the clinic, see it, look around it, so I wouldn't get lost the next day and I wouldn't be surprised the next day. And it kind of gives me a good idea of how long it's going to take me to find the clinic and park at the clinic and walk to the clinic and find the location. So if you want to do that, it's really helpful. Arrive early in the morning or the day before, go to that clinic so you're not confused. Especially in big hospital systems, it's really, really easy to get lost. I know at my endocrinology rotation, it was in a hospital, and if I had not gone that day, like the day before, easily would have gotten lost. So I'm really, really glad that I did that. And if you're going to be in a hospital system, I really recommend scoping out the place a day earlier. So yeah. So you're finally at the clinic, and what should you expect? I want to say about the first couple days, you're going to be observing, especially if it's your first rotation. You might observe just for the first or second day, and then you might immediately be seeing patients right after that. So I wrote it all down here. So maybe first or second day, you're observing, you're getting comfortable with the location, you're figuring out where things are, you're seeing how the flow of things are. And then you get comfortable, and then after that, maybe now you're confident enough to see patients. So what you would do is you'd ask your preceptor, hey, I'm gonna go see this patient. Is that cool? And they'd be like, yeah, go ahead and see them. So you'd see the patient, you'd take their history, figure out why they're here. You'd perform an appropriate physical examination. Obviously, you don't want to do like an invasive physical examination. Like if they're having genitourinary complaints or an anal sphincter test or a breast exam, I would just defer that and tell your clinical preceptor that. You shouldn't do that by yourself, especially as a student. I made a mistake. I did a breast examination on a patient that I didn't realize I wasn't supposed to do. They were here for a lesion, and she was very comfortable. She had showed me, and I had quickly palpated the breast and did a breast exam and checked for lymph nodes and stuff. But I was told like, hey, just wait for me until I come in to do that type of exam because it might be a little too invasive. And I was like, all right, like that's fine. But other than that, just for exams that might seem invasive or too much, just wait for the preceptor to come in first, or inform them, and then they'll do the physical examination with you or for you. So you take their physical examination and kind of make a mental note of what do you think this could be. Right, so you take their history, you take their physical exam, and then now you have a possible differential diagnoses of what this could be. And then in the next step is that you want to come up with a treatment plan. So in your head, you don't have to tell what your preceptor what the diagnosis is. They'll probably ask you, so what do you think this is? You'll have that in your head, right? And then, oh, I think it's this thing. And then, okay, so what do you want to do about it? Is what your preceptor might ask you next. But like, I want to do this treatment. I want to give him lisinopril. I want to increase their dose for this medication. Let's give him this steroid. So your preceptor might ask you that. So you take your history, you take your physical, and make a mental note of what the possible diagnosis could be, and then have a couple of differential diagnoses, and then possible treatment plan. That's kind of what it would be. And then you go out, you tell your preceptor your findings, the physical exam that you performed, and then you go back in with your preceptor, and the preceptor takes a look at the patient, does their physical exam, discusses the diagnosis, and discusses the treatment with the patient. So that's kind of what it's going to be like. I really recommend, especially in your first rotation, get very, very comfortable with doing physical exams. Getting comfortable with touching your patient, doing their heart and lungs. Listening to normals is also a really important thing, because just like listening to normal heartbeats all the time. So that way, one day you're going to hear an irregular heartbeat and it's not going to sound normal. You might not know what it is, and that's okay. But as long as you realize, this sounds kind of abnormal. I don't know what it is, but their rate is kind of high and their rhythm seems kind of weird. I don't know what it is though. And you might be right. So knowing what normal looks like versus abnormal is really, really important. Knowing what sick looks like versus not sick is very important, and something that you're going to figure out and learn during your clinical rotations. And that's something that I'm doing as well. I think this is pretty much the last thing. I wanted to make this a short video. If your preceptor tells you, hey, do you want to do something? You just say yes. If your preceptor says, hey, do you want to take out this gallbladder? Hey, do you want to hold this? Hey, do you want to drill this thing in? You say yes, because likelihood is they're giving you an opportunity to learn and you should take it. They're never going to let you do something that will harm the patient. They're always going to be there. They're always going to be looking at you and beside you. So don't be scared. Be confident. You're going to be fine. You're going to make it through. Clinical rotations, I like 10 times more than didactic here, because you're finally applying what you're learning to your practice. You're finally applying what you're learning. And yeah, I kind of stumbled on my words there. Anyways, thank you so much for watching. I hope this was helpful. I know every rotation is going to be different, so this is kind of just like a general overview of what to expect during your clinical rotations. All right, best of luck. And if you have any questions below, feel free to type them in the comments. Feel free to subscribe. I'm going to try my best to upload videos once I have time. All right, thanks for watching.